Hi, my name is Mackenzie Wolfe. I am going to be answering the questions for this week's reflection for our child and adolescent class. The first question is, how comfortable are you working with children as a nurse? I have never taken care of a child or an adolescent as a nurse. I think the youngest age that I've taken care of is 17. And I don't remember the specific diagnosis of the patient. I work on an adult medical surgical floor. The only other, as a nurse, and not even as a graduated nurse, I guess, in clinical and undergrad, I did have a rotation in my maternal child semester where I was exposed to children and adolescents. However, I hadn't graduated yet and I wasn't taking care of the patients on my own. So I would say in regard to how comfortable I'm working with children as a nurse, I would say that I'm not. Respectfully, I just haven't had much exposure to working with children. As a nurse practitioner, since I'm in my second semester of clinical and my first semester took place in the spring of this past year, the clinical semester was cut short due to COVID. So while I did get some exposure to some children because the facility that I was completing my clinical at did take children as patients, I didn't see that many of them. So still I don't feel entirely comfortable taking care of children and adolescents respectively as a nurse practitioner. What do I perceive as being challenges to working with children? One of the major challenges that I encountered in the times that I did deal with children in my clinical experience in the spring of 2020 was participation. Depending on the age of the child, the mental capacity, their development, they may or may not be able to sit still long enough or be willing enough to answer questions. So I found that to be a little bit difficult and challenging. Additionally, whenever you're working with a child or an adolescent, you're going to have to deal with the patient's guardian, whether that's their parent or their grandparent or whoever that might be. And that can present challenges in itself. It's not always easy. Parents respectfully get very anxious when it comes to their child and their treatment. So navigating that I perceive to be a little bit of a challenge. Navigating, which is another question later on, but navigating the ethical side of working with children and adolescents, I perceive to be a challenge, and I'm actually really excited to learn more about that part of child and adolescent psychiatry. And I guess we can talk about, so question number 4 was, what are some ethical considerations for working with the pediatric population? I think one of the biggest ones would be related to confidentiality. And I am still a little not certain about how to go about dealing with the confidentiality piece in regard to child and adolescents. So I'm looking forward to learning about that this semester, but dealing with what can I tell a parent, what can't I tell a parent, what is required and mandated to share, aside from suspecting abuse and that kind of thing. So confidentiality is a huge piece that I think ethically will come into play when it comes to dealing with children and adolescents. Autonomy is another one. The patient's right to choose their treatment. State by state, I'm sure there are differences when it comes to that. A child's age is going to come into play, their developmental level, whether they're capacitated or not, deemed capacitated. So I think ethically that might be an issue. Also just, and this pertains to adults as well, but duty to protect, beneficence, do good. Those kinds of ethical considerations will come into play in dealing with children as well. If threats are made, for example, a child comes in, says that they're planning on seriously harming a specific individual, ethically, that needs to be reported. Like I said, in regard to abuse, ethically, that needs, any suspicion of that does need to be reported. I think I did answer what have you seen in clinical practice. When it comes to children and adolescents, I was mostly exposed to, I had a few children or teenagers that I encountered that were dealing with depression, had gone through a few trials of medication. I did see one two children actually in therapy who were suffering from schizophrenia, which was interesting. I also saw some ADHD, also interesting. So I've seen a few things. I just haven't been exposed to as many adolescent patients as I would like to. And I guess that brings me to the last question, which is, do you think you will search for a position working with children? I wholeheartedly do want to search for a position working with adolescents and children. I'm not sure what the opportunities are as far as in the community to be able to do that. However, and while I don't work on a pediatric floor, it is, I believe at this point, what I want to do. And if I wasn't in school, to be honest, I probably would have transferred to a maternal child, so a pediatric type floor, whether it be at the hospital I'm currently working at or another facility. I probably would have attempted to do that. It just didn't make sense with school. So I would like to seek a position working with children and adolescents. I think that I'm also interested in adults, so if it was a combination of both, I wouldn't be opposed to that. If it was one or the other, I would like to choose to work with children and adolescents. I feel like, you know, I just find them interesting. I find their vulnerability and their the pureness that they have about them, I find it intriguing. I love being around children. I enjoy talking to them. I really think that there needs to be more providers out there that do want to and feel comfortable providing care for those patients, and I want to be one of them. So ideally I would like to, long story short. And that concludes my video. Thank you for listening.